Welcome to Part 2 of our OHSA training, focusing on essential life support and first aid procedures. Let's dive into critical safety measures. Liquid chemical burns can cause severe injuries. It's crucial to recognize and respond to these emergencies swiftly to minimize harm.
For dry chemical burns, always use personal protective equipment, conduct a survey, and follow MSDS instructions. Neutralize and wash away chemicals carefully.
In cases of electrocution, break contact and shut off electricity immediately. Use non-conductive materials to protect yourself and the patient. For electrocution victims, ensure safety first. Call for help, perform CPR if needed, and treat burns with appropriate dressings.
Heat-related illnesses like hyperthermia and hypothermia require prompt attention. Understanding the symptoms is key to effective treatment.
Hyperthermia can result from dehydration and extreme temperatures. Recognize symptoms like heat cramps and exhaustion to act quickly. To treat hyperthermia, remove the patient from heat, loosen clothing, and rehydrate. Always call for medical assistance if needed.
Prevent heat stroke by addressing heat exhaustion early. Cool the patient with water and wet sheets, and ensure they stay hydrated.
Hypothermia symptoms include shivering and impaired judgment. Recognizing these signs early can prevent severe complications. For hypothermia, remove the patient from the cold, dry them off, and cover with warm clothing. Seek medical help immediately. Inhalation of harmful substances can cause serious symptoms like confusion and shortness of breath. Quick identification is crucial. For inhalation emergencies, use protective gear, ensure clean air, and treat injuries promptly. CPR may be necessary if breathing stops. Never enter an environment with smoke or chemicals without proper protective equipment. Safety first to prevent inhalation injuries. Ingestion of harmful substances can lead to symptoms like burns around the mouth and unusual breath. Recognize these signs quickly. For ingestion emergencies, identify the substance, follow MSDS instructions, and contact poison control. Keep the patient stable. Snake bites are a serious occupational hazard. Knowing the risks and first aid measures can save lives in these situations. For snake bites, keep the patient calm and the injury below heart level. Call for emergency help and be ready to perform CPR. Apply a pressure bandage correctly for snake bites, avoiding tourniquets. This helps control venom spread effectively. Avoid common mistakes with snake bites, such as sucking venom or applying heat. These actions can worsen the situation. The puff adder is notorious for being one of Africa's deadliest snakes. Its venomous bite can be extremely dangerous, making it crucial to be aware and cautious in areas where it resides. Many people are unaware of their allergies to bee stings until they experience a reaction. Symptoms can include facial swelling and difficulty breathing due to airway blockage. Recognizing these signs early is vital for effective treatment. When dealing with bee stings, it's important to conduct a secondary survey and ask about allergies. Avoid removing the sting with fingers or tweezers. Instead, scrape it off and apply a cold pack to reduce swelling. Be prepared to provide CPR if necessary and seek medical help immediately. Bee stings can cause both external and internal swelling, as shown in these images. It's important to monitor the affected area and seek medical attention if symptoms worsen. Stress fractures are hairline cracks in the bone caused by repeated or prolonged forces. They require careful management to prevent further injury. An open fracture occurs when a broken bone punctures the skin, while a closed fracture does not break the skin but may involve internal bleeding. Both types require immediate medical attention. Complicated fractures can damage nerves and tissues, while green stick fractures, common in children, involve bones bending without completely snapping. Understanding these types helps in providing appropriate care. Fractures can present with various symptoms such as bleeding, bruising, pain, and unnatural movement. Recognizing these signs is crucial for timely and effective treatment. These illustrations show the differences between compound and closed fractures. Understanding these visuals aids in identifying the type of fracture and the necessary first aid measures. This image depicts an open fracture, where the bone has broken through the skin. Such injuries are severe and require immediate medical intervention to prevent infection and further complications. Green stick fractures, often seen in infants, involve the bone bending rather than breaking completely. This type of fracture requires careful handling and appropriate medical care. A closed fracture of the wrist, as shown here, involves a break without the bone piercing the skin. Proper immobilization and medical treatment are essential for recovery. This image shows a closed fracture of the collarbone. Such injuries need to be immobilized and treated with care to ensure proper healing. When providing first aid for fractures, conduct a secondary survey and call for emergency services. Immobilize the injury and avoid moving the patient unnecessarily. Treat for shock and ensure the patient is comfortable until help arrives. The golden rule in fracture first aid is to keep the injured area still. Avoid moving the patient unless necessary, and do not test the bone's ability to move. This helps prevent further injury. Using a newspaper splint and padding can effectively immobilize a broken forearm. Proper splinting is crucial to prevent further damage and aid in the healing process. An arm sling can provide support and minimize movement for an injured arm. Proper application is key to ensuring comfort and promoting recovery. Securing the sling to the body minimizes movement and provides stability to the injured arm. This step is essential for effective first aid. For shoulder injuries, an elevated arm sling can offer support and comfort. Properly positioning the arm and securing the sling ensures effective immobilization. Applying an elevated arm sling involves placing the bandage over the forearm and tucking it securely. This technique provides stability and aids in the healing process. Securing the bandage at the back ensures the elevated sling stays in place, providing necessary support and minimizing movement for the injured area. Sprains and strains are common injuries that involve the tearing or stretching of ligaments and muscles. They often occur due to twisting or falling, affecting areas like ankles, wrists, and joints. Symptoms include pain, swelling, bruising, and cramping. The Rice method is essential for treating sprains and strains. Rest the injured area, immobilize it to prevent further injury, cool it with ice to reduce swelling, and elevate it to minimize swelling. Dislocations occur when joints are forced out of their normal positions, often due to falls or blows. This can affect various joints like ankles, knees, and shoulders, causing severe pain and swelling. When dealing with dislocations, conduct a secondary survey and call for medical help. Make the patient comfortable, immobilize the joint, and only allow a medical professional to attempt relocation. Head injuries can be severe and include open lacerations, skull fractures, concussions, and compression. Each type requires specific attention and care. Head injuries can manifest through various symptoms, such as fluid leakage from the nose or ears, bruising, changes in consciousness, and severe pain. Recognizing these signs is crucial for timely intervention. For open lacerations on the scalp, apply pressure to stop bleeding, which may take up to 45 minutes. This is a critical first step in managing such injuries. Conduct a secondary survey and call for help. Keep the patient comfortable, apply pressure to the wound, and cover it with gauze. Secure the bandage firmly but not tightly. Skull fractures are serious injuries that can cause depression or dents in the skull. Immediate medical attention is necessary to prevent complications. In the event of a skull fracture, conduct a secondary survey and call for emergency services. Immobilize the patient, avoid blocking blood flow, and position them properly to reduce infection risk. If a foreign object is lodged in the head, do not remove it. Stabilize the object and seek immediate medical assistance to prevent further damage. Concussions can cause memory loss, confusion, blurred vision, and nausea. Recognizing these symptoms early is vital for effective treatment and recovery. For concussions, conduct a secondary survey, treat visible injuries, and monitor consciousness. Keep the patient cool and hydrated, and seek medical help if symptoms persist. The spine is crucial for structural support and movement. Injuries to the neck and spine can be severe, potentially leading to paralysis or even death if not handled properly. Any movement of a person with a suspected spinal injury can be dangerous. The golden rule is to keep the spine still to prevent further damage. Do not move a patient with a suspected spine injury unless absolutely necessary. This is a job for emergency medical services to prevent life-threatening complications. The spine provides essential support from the hips to the head, allowing for movement and flexibility. Understanding its structure helps in recognizing the severity of spinal injuries. Any movement of the head or neck can damage the spinal cord, leading to paralysis. It's crucial to handle such injuries with extreme care. The jaw thrust technique is used to open the airway without moving the head or neck, crucial in cases of suspected spinal injury. In emergencies, repositioning a patient with a spine injury should only be done if absolutely necessary, such as to perform CPR or clear the airway. In emergency situations, rescuing a patient from hazardous conditions is crucial to save their life. These dangers include collapsing structures, electrocution, fire, explosion, drowning, and toxic gases. When repositioning a patient in danger, it's vital to clear their mouth, prevent choking, perform CPR, stop bleeding, and place them on a trauma board to save their life. Calling for help is the first step in performing a patient log roll. Ideally, 4 to 5 assistants are needed to support the neck, head, and spine, ensuring the patient's safety until EMS arrives. The log roll team must be well coordinated, with the leader at the patient's head and assistants on each side. Proper positioning and teamwork are essential for safely moving the patient. Clear communication is key during a log roll. The team must roll the patient in unison, place the spine board, and secure the patient, ensuring no movement of the head or neck. When dealing with suspected neck and spine injuries, it's crucial to keep the head, torso, and legs in a straight line to prevent further harm during movement. Using a spine board is essential for supporting the neck and spine when moving a patient, ensuring their safety and preventing additional injuries. Heart attacks can present with severe chest pain, shortness of breath, and sweating. Recognizing these signs early is vital, as they can lead to cardiac arrest if untreated. In the event of a heart attack, conduct a secondary survey, treat for shock, and prepare to perform CPR. Encourage the patient to relax and call for emergency medical services. Laying the patient in a half-sitting position can help ease breathing and reduce strain on the heart during a heart attack, while waiting for medical assistance. Angina symptoms, such as chest pain and shortness of breath, often occur during physical exertion. It's important to take these signs seriously and seek medical attention immediately. During an angina attack, conduct a secondary survey, treat for shock, and ask about the patient's pain history. If symptoms persist, treat as a heart attack and call for help. Stroke symptoms include flushed skin, slow pulse, and unequal pupils. Quick recognition and response are crucial, as most stroke patients become unresponsive immediately. For stroke victims, conduct a secondary survey, treat for shock, and position them safely. Be ready to perform CPR and call for emergency medical services immediately. Diabetes results from high blood sugar due to insulin shortage. Insulin regulates blood sugar, and its lack can lead to serious health issues, requiring careful management. Type 1 diabetes often presents with thirst and fruity breath, while type 2 may cause pale skin and dizziness. Recognizing these symptoms helps in providing timely care. In diabetic emergencies, determine the type of diabetes and whether the patient has taken insulin. Provide sugar for type 2 if needed, and seek medical attention promptly. For unresponsive diabetic patients, treat as type 2 if recovery is rapid. Administer sweet substances around the gums and call for medical help immediately. Asthma attacks can be triggered by stress or allergies, causing difficulty breathing. Patients often manage with inhalers, but severe attacks require immediate attention. During an asthma attack, assist the patient in using their inhaler and encourage them to sit comfortably. If breathing difficulty persists, call for emergency medical services. Seizures progress through 4 phases: aura, collapse, convulsion, and relaxation. Understanding these phases helps in providing appropriate care and support.